So most children that we see here tend to come out with malaria. So we need to confront that before we start our treatment. Then the other one includes food log count. Food log count gives us a picture of the three cell lines in the body: the red cells, the platelets, the white cells. So with this, it tells us, based on an idea, suggests to us, is this child having an infection? What kind of infection would you think that this child is having? Is it a bacterial infection? Is it a viral infection? Then we'll do a lumbar puncture for CSF analysis. CSF is cerebrospinal fluid analysis. That's for those that we think that have meningitis or encephalitis. That's infection of the brain and problems of the brain. Chest X-ray is very important for those that have features suggestive of pneumonia. When we see certain peculiar features, such as infiltrates in the fin. For those that have frequent abdominal pain, or those that may present features suggestive of intussusception, which is where a part of the gut goes into the other part of the gut, is an emergency, we need to do abdominal ultrasound scan. Then we also do cultures, microscopic culture sensitivity of stool, urine, eye swab, throat swab, ear swab, depending on how the child presents. And if there's any abscess, also take samples and send for microscopic culture sensitivity. Blood culture tells us the kind of organism that the child is having for those that have septicemia. Then hepatitis screening, because oftentimes those that have hepatitis B or hepatitis A also come up with fever. So we screen do the pallial screening. Then serology tests. Also, HIV is still with us. Children with HIV can also present with fever. Then the other serology that we do includes toxoplasmosis and chlamydia. We also do investigations, video tests. We just do it twice. It helps us to confirm that these patients must have had infections by salmonella, that's typhoid fever. Okay? Then the treatments. How do we treat fever? The one thing that we do is to give antipyretics. Antipyretics are medications like paracetamol, ibuprofen. All of you must have heard this before. And what they do is simply to prevent the production of prostaglandin. Remember earlier on I told you that prostaglandin, what they do is that when they are produced, they attach to the hypothalamus in the brain, reset the brain, and leads to fever. So if there's no PGE2, the moiety is not there, then there won't be any fever. So the paracetamol and ibuprofen are commonly used, and the doses we only give it in per kg per dose. But if you don't know how to do that, you can use the look at the leaflet written on the brand of the paracetamol that you bought and follow the direction written there. Then the other one is you need to expose the child, remove the clothing. Remember, as I told you earlier, when you remove the clothing, it will help in heat loss by evaporation, also help in heat loss by radiation, and also aid in heat loss by convection, when we discussed that earlier. Then you take a sponge. Take a sponge simply means you are using lukewarm water, tepid water, to transfer energy or heat from the body to the water beside you. So we commonly use the towel. Get a towel, put inside the water, then remove excess water, place it on the child's trunk, where the front, still like 10 seconds, turn the other surface of the towel, another 10 seconds, then transfer it to the water. Remove excess water, then do snapping at the back. Now when you do that, it will help to reduce the temperature faster than even the medications we do. We call it reducing temperature by lysis or by crisis. It's very, very efficient if emphasis is placed on the trunk. Not take towel, you put on the forehead, put on the hand, you say you're sponging. No. Emphasis should be placed on surfaces, large surface areas. That will help to transfer energy faster away from the child. And how you know you're doing well when you're doing TP sponging is the water you are transferring the energy to, as the water you're using start becoming warmer, if not hot. That's how you know that you're doing real TP sponging. Then within 24 to 48 hours that the child has fever, please you bring the child to the hospital, because use of antipyretics like paracetamol and ibuprofen and TP sponging, it will not cure the child. We need to treat the cause of the fever. Once again, fever is not equal to malaria and typhoid. The child must be brought to the hospital so that we'll do a clinical rundown and treat what is causing the fever, so the child will be okay. There are some first aids that must be at home. Number one is a home thermometer. Every home must have a home thermometer. In fact, we recommend the digital thermometer. That's the best. The one that has battery inside it. There are so many brands on the market. I don't want to name any brand here. So it's very easy to use. The pharmacist in the shop can teach you how to use it. Just press the button, you see LO, low. Once it shows LO, put it inside the tip of the thermometer, inside the armpit. Hold it. Once you hear it clicking sound, take the reading. If it is, if what you're seeing is above 37.5 degrees, that's 37.5 degrees and above, then your child has fever. And once you notice that, start your antibiotics, TP sponge. If it continues, by the second day, bring the child to the hospital. And secondly, every home should have at least paracetamol. You must have paracetamol in the house, please. Alright, let's go to the complications. The common complication of fever is what we call febrile convulsion. Yes, it runs in the family. Febrile convulsion simply means somebody who is having fever and the body is shaking. That's what it means. It tends to be more in some families, may run the family, and the convulsion appears to be at the peak of fever when the fever is quite high. Please, when this starts happening at home, your emphasis should not be towards the convulsion, not fever anymore. Please, what you're going to do, simply, if there are constricting clothing, remove it, place the child on one side of the body, then bend the neck backwards a little bit and call for help. The help I'm calling for is to take that child to the hospital immediately. If you've taken sponging before, stop. Once again, your child is having fever and is convulsing. If there's any clothes or anything that will constrict his neck, remove it. Bend the neck a little bit backwards. Hold the child on one side of the body, then call for help. Do not put your hand inside the mouth. It's a very common practice. Do not put spoon inside the mouth. If you put a hand inside your mouth, it can bite you and cut your finger off because the muscles are contracting. Do not put oil inside the mouth. Oftentimes we have cases, the child that was convulsing in the house, they use palm kernel oil, they pour palm kernel oil on the body, they won't give the child the oil to swallow, child end up aspirating the oil, and once that oil enters into the trachea, that's especially pneumonitis. It's bleeder, it kills. So, and also, do not carry the child that is convulsing on top of fire. In some places, they will put fire in their stove, fire is burning, you carry the feet on top of the fire, child is convulsing, and you're putting child on top of fire. It doesn't make sense. Child end up with what? Burns. So, please, what you do is very simple. Try as much as you can and take the child straight to the hospital. Don't do any other thing. Now, the exacerbation of illness can also be worsened by fever. And these fever can also, because of increased sweating, can lead to severe dehydration and if not shock. Another thing that can happen is acute renal failure because of increased sweating, dehydration, reduced blood supply to the kidneys, and as the muscles are contracting, that's what we call myoglobin. Myoglobin are like hemoglobin in the red cells, in the muscles. They are being broken down during vigorous contraction, and as they're going to the kidneys, they can block and cause injuries to the kidneys and cause myoglobinuria. So these are the complications that follow this. So what happens is once a child has the fever, please try as much as you can and bring the child to the hospital. Then next, we are going to discuss about how to prevent these diseases. It's a very common something to know. None of them are new. So we'll start from antenatal period. If you're pregnant, please try as much as possible and register early. Early, 6 weeks, just register early. And be regular in your antenatal care visits. Please. Then you ask questions. Ask questions. I was in the session yesterday. The women were asking a lot of questions pertaining to their children. And the questions you're going to ask are questions if you know of any religious practice, cultural practice, beliefs that your child may undergo after delivery. Please ask those questions during antenatal care visits. If you're not comfortable on the answer you're getting, look for a pediatrician and get answers. So you go home and do another thing to your child and not bring a complicated case for us to do magic on. Please. Knowledge is power. Report any symptom that you notice during pregnancy to your gynecologist. It's very, very important. So start treating immediately, early during the pregnancy, so it will not affect the child, your unborn child. And make sure you adhere to all the instructions, like taking your routine medications, taking your malaria preventive therapy. Because children can have what we call congenital malaria. They can acquire malaria from the mothers. So please make sure you take your malaria medications during pregnancy. Then second preventive mechanism is exclusive breastfeeding, which is only breastfeeding for the first 6 months. No water, no infant formula, nothing. Then by 6 months you start weaning, start adding milk, gradual weaning, and breastfeed up to 2 years of age. Please, breast milk is the best form of food for the children who are less than 2 years of age, especially those who are less than 6 months of age. It has a lot of substances, molecules in it that help us to fight and prevent infection. A lot. Like immunoglobulins, antibiotics, probiotics, a lot. So, rarely will you see any baby that is on exclusive breastfeeding coming to the hospital. Rarely. So that is very, very important, exclusive breastfeeding. And if you are a working class lady, when you are going to work, maybe by 4 months, one baby is 4 months, you can express the breast milk and keep. Let some other person help and feed your baby. Okay? Then immunizations. According to the National Program on Immunization Schedule, that must be done to every child. Because these diseases that we are immunizing against are common diseases that cause deadly, that are fatal in childhood. Tuberculosis, pertussis, diphtheria, measles, many of them. Now these days we are looking for maybe by the beginning of next year we expect to have COVID vaccine. There are in the news there are advances of from 2 companies that have found COVID vaccine. Now we are currently, there are some epidemics in the country, in Enugu, Bauchi, of yellow fever. Yellow fever, when you get immunized, gives protection for about 10 years. Children, we give them when they are 9 to 12 months of age. So those who have not gotten the yellow fever should go and get the yellow fever. For those of you who always travel, remember they ask you for your yellow card. Now everything is now being inbuilt in a database, so that you can assess anyone in the world whether any person who's coming from Nigeria has been immunized. So yellow fever immunization is very important. So generally, immunization against all these diseases, common diseases that cause morbidity and mortality is very important. Then sleep under long-lasting insecticide-treated nets. Very important. Yellow fever is actually we should do more yellow fever. Yellow fever is causing a lot of deaths in some states now, and it is transmitted by some species of mosquito, Aedes aegypti, Aedes africanus, and one of the basic ways to prevent that is to sleep under mosquito nets. Wear long clothes to prevent the bites. The same thing also goes to anopheles mosquitoes, female anopheles mosquitoes that cause malaria. The same measures against it. If you can lay your hand on insecticide, you can spray that. Now, we are in the coronavirus pandemic. Please always wear your mask wherever you are. Physical distancing, hand hygiene, always this tripod will always help everybody to prevent acquisition of the virus. In children, is safe. The WHO recommends those above 2 years of age, they can wear their mask. Then clean environment, make sure you get potable drinking water, remove all drainages, stagnant water, which are breeding places for mosquitoes. Make sure before and after preparing any food, before and after changing diapers, please always wash your hands. Always, in fact, if you're able to wash your hands, you would have reduced infection transmission by more than 70%. So hand washing, hand hygiene is extremely very, very important. Okay? And then lastly, you must always follow the doctor's instructions. Always follow the doctor's instructions once your child is reviewed in the hospital. So in conclusion, fever is a very common presentation of a variety of diseases. It is not equal to malaria and typhoid. This is about the third time I'm saying this. Commencement of paracetamol tepespongin at home is important in the prevention of its complications. Taking the child to the hospital or clinic for full review is sacrosanct, as this will help reduce childhood mortality. And that's our goal number 3 in the SDG goal number 3, like it's 2 and 3. Sustainable Development Goals. So on this occasion, we've come to the end of this presentation, and if there will be any question, I will be glad to answer any question from anybody at this junction. So, questions? Okay, any question from anybody? You can write your comment in the comment section. I'm seeing some comments there. Okay. How long can I stay with a child at home before bringing the child to the hospital? Okay. It's a question from somebody. Once the child has fever, don't stay more than 2 days at home. Please, the child has fever, and I said earlier on, every home must have an antipyretic, paracetamol or ibuprofen. And you should be able to start tepespongin once the child is febrile. So what you do first, expose the child to the sponge. That's after you must have taken the child's temperature. Yes, those days it's very easy. Doctor, my child is hot. How do you know your child is hot? I touch the face, the body. Sorry. I notice that the child is hot. Oftentimes, that may be a normal diurnal variation, and the mother may actually be telling the doctor her own temperature. Mother may be sick, actually. So that's why we insist on you at home having a home thermometer. So within 2 days, of having the fever, please bring the child to the hospital. Just by the second day. Don't stay more than 2 days, please. Alright. Then what are the symptoms that I have to watch out for to know the child has fever? Fever itself is a symptom. Yes, it's a symptom. It seems the person who asked this question didn't start at the beginning. Fever is not a diagnosis, please. It is a symptom, and it cuts across all the systems in the body. It's not peculiar to any particular system. It is not equal to malaria. It is not equal to typhoid. It is not equal to malaria and typhoid. Do you understand? So, fever is a symptom, it's not a disease. So, once the child has fever, if you touch your child's body and your child is febrile, or you've used thermometer on your child, notice that temperature is above 37.4 degrees Celsius, your child has fever, simply start giving your child an antipyretic like paracetamol. The questions I've answered earlier on, this question here, if my child has temperature of over 37.5 degrees Celsius, does that mean the child has fever? Yes. As I said earlier, fever is defined as body temperature at least as more than 37.5 degrees Celsius. So a child has fever and you should bring the child to the hospital. Then, what are the symptoms that I have to watch out for to know the child has fever? No, fever itself is not the concept. Whoever asks this question thinking that fever is a diagnosis, fever is a disease. No, it's not a disease. Fever itself is a symptom. Please. So you only need to watch out when the body is hot. So when the body is hot, you just go on and take a sponge, remove the clothing, then take the sponge, the body, then give your antipyretics. If it happens the following day, repeat what you've done, then bring the child to the hospital. So please don't stay more than 48 hours at home without coming to the hospital. Because in children, if we start treating them early, they go early and will reduce complications. The other question I have here is, how long can I stay with a child at home before bringing the child to the hospital? Okay? As I said earlier on, please don't stay more than 2 days, not stay more than 48 hours. The earlier we do things, the better. And why you stay this period is, remember what I said earlier on concerning the normal diurnal variation of the body temperature. Body temperature can increase in the afternoons, then gradually go down in the evening. That is not fever per se, it's a normal. So are we having a normal variation or exaggerated normal variation? So that's why you should watch the child for 2 days, day 1, day 2, then continuously bring the child. Don't stop for 8 hours. Alright? Question, this question time. What I have here is from another person. When a child has fever that is cold and shivering, should he still be tepid-sponged, or can we use hot water at such times because the child wants to maybe stay in the sun? Now, this is a very intelligent question. I was actually expecting this question. Now, if you remember when we were discussing about fever, how fever comes about, the mechanism of fever development, that new set point temperature, normal 37, or maybe set up to 38 degrees Celsius or 39 degrees Celsius, the body is shivering. That time the body is shivering, muscles are contracted, they are generating heat. That is when the child will feel cold. We call it cold and shivering. That's actually when the child is, because the body is generating energy within itself to reach that new set point that the hypothalamus have set. So what you do at that point in time, that is one phase. What people do at that point in time is to cover the child, help the child achieve that new set point temperature faster. You understand? And if we do that, you watch the child at a time within minutes will stop shivering. Once that child stops shivering, remove the clothing, start tepid-sponging. You understand? Because if you start tepid-sponging, you may offer some, that time the child is having shivering, you may offer some autonomic functions that the child is having itself, the body is helping itself to achieve that new set point temperature. So help the body reach that temperature by covering the child first. Once that shivering stops, remove your covering, then start tepid-sponging with your lukewarm water. You understand? So that is what you are going to do that time. The other question, or can we use hot water at such times? No, do not ever use hot water, please. It is called lukewarm water. Lukewarm water is water that is the temperature, you put your hand inside the water, is between cold and warm. As lukewarm. Those are called tepid. So that's what you should use. Don't use hot water. Hot water will come on and burn off the child's skin. Once again, in the mechanism of formation of fever, of development of fever, there are three phases. As I said earlier. First phase is the shivering phase. Second phase is when the body now reaches that level, it plateaus, becomes steady at that 39 or 38 degrees Celsius for some minutes. You know? And the third phase is when the temperature comes down. When the child now starts sweating a lot, because of vasodilation within the skin. So when you actually start tepid-sponging is when you notice the child has reached that plateau, is no longer shivering, but the body is hot, start tepid-sponging. Okay? So these are the questions that we do. Oftentimes, some people go on and start tepid-sponging when the child is shivering. Yeah, it may. In fact, most children who are shivering and tepid-sponging, they won't even allow you, they run away from you. Because to them, the environment is cold, although it may be hot. The environment is cold, the skin is cold, but inside them they are burning up. They are trying to raise temperature to a particular new set point temperature. And this shivering usually lasts a few minutes, usually less than 5 minutes. Less than maybe 3 minutes at most. Then the plateau phase, that is when you start tepid-sponging. Okay? Do we have any other question in our platform? Any other question? It's the question time. More question. There's some people who want to. Okay, I'm going to call some numbers later after this. Okay. At this point in time, I'll be calling the show off. At this point in time, thank you everybody for listening. Thank you for tuning in. Sorry for the breaks because of some circumstances beyond our control. These program, these slides I use for this program will be shared in our Facebook. Everybody will have access to that. And also the video is going to be made free in our Facebook page at Princess Medical Center. So thank you very much. Thank you for tuning in. God bless you. There's some phone numbers. I should call them. Okay, I'll call these phone numbers after the show. Understand? Yes, if you have any questions, we'll discuss. That's some phone numbers here. Alright, thank you once again. God bless you and a happy weekend. Okay? I've cut it off. Why should I pull off your phone? No, it's not.